So this surgery killed 3 people with just one surgery. Before 1846, every single surgery was performed while the patient was completely awake. No anesthesia and no number. So because of that, surgeons were not judged by how clean their work was. They were judged by how fast they could finish. The faster the surgery, the less time the patient had to suffer in pain. And in the 80s, one of the fastest surgeons alive was a man named Robert Liston. He was famous for amputations. In fact, he treated every amputation like he was speedrunning a game. Before starting, he would literally ask someone to time him so he could try to beat his personal record. But one day, his need for speed went horribly wrong. While performing an amputation at full speed, he swung his surgical knife so quickly that he accidentally cut off his assistant's fingers along with the patient's leg. When Liston realized what had happened, he jumped back in shock. As he walked away, his blade covered in blood lightly touched the coat of an elderly doctor who was standing close by watching the operation. The doctor thought he had been stabbed. He collapsed from fear and later died of a heart attack. Meanwhile, both the patient and the assistant developed serious infections, which were extremely common at that time, and they later died as well. So he literally killed 3 people with just one surgery. The case became known as the 300% mortality surgery. It perfectly shows how terrifying surgery was before modern medicine. Back then, being fast could make you famous, but it could also make you deadly. If this story interests you, please do well to follow and subscribe for more stories.